Hey everybody, Dr. Patel here. Sorry about being so delayed in our Facebook Live, but I hope you all are doing well. Hope you are enjoying your Friday. And we have an interesting topic today. We're going to be talking about headaches. So, if this is your first time joining, please bear with me. I'm going to be going over a lot of stuff. I'm going to draw on the screen. We're going to talk about a few things. And if you find this interesting, if you like this, please like it, follow, share, all that fun stuff. If you have any questions, please feel free to comment, or you can DM. You can email us at info@fxregencenter.com. Or you can call us if you have any specific questions about your condition. You can email us at info or call us at 310-929-9790. So, without further ado, I'm going to talk today about headaches. There's a lot of different types of headaches, and I'm not going to talk about everything. It's quite impossible to talk about all the different types of headaches that are out there. But I am going to go through some specific things, and there are some specific types of headaches that regenerative medicine treatments can actually help a lot with. So I'm going to go through a little bit of that. With this, I'm going to talk a little bit about the anatomy and explain some of the different things that could be causing headaches in the first place, and then we'll go through different treatment options. And we're going to dig into some of these other topics more in depth with future Facebook Live videos. So please feel free to contact us if there's any specific part of this that you want to hear more about. So, headaches. What kind of headaches are there? There's actually a ton of different types of headaches, and I want to try to simplify this as much as possible. So first I want to talk about the 4 types of headaches that are on the screen right now. And then I'm actually going to talk about some completely different headaches, because quite frankly, these type of headaches that are on the screen right now are not really the type of treatments, type of headaches that we can treat with regenerative medicine treatments. But these type of headaches include tension headaches, migraines, and cluster headaches, which could be caused by a variety of different things. But the typical tension headaches are, when you have that pain that's in the front of your head, or that feels like a vice wrapping around your head, things along those lines, often associated with anxiety and stress, or things like lack of sleep, lack of hydration, various different things that can cause tension headaches. And these are the type of things that typically resolve on their own with resting, with sleeping, with a Tylenol, or just hydration, things along those lines. Migraines can actually come in a variety of fashions themselves. Sometimes migraines involve just one side of the face, as depicted in this picture. But sometimes migraines could attack just particular parts of the head. Oftentimes, your more classic migraines are associated with things like an aura, or some kind of sensation that may be preceding the headache. Something like nausea or vision changes, spotty vision, things along those lines. Some people have auditory headaches. And oftentimes these headaches could be so severe that we have light sensitivity. We want to turn off the lights or stay away from loud sounds. And these can be even associated with things like vomiting, right? We're in so much pain that headache causes us to have nausea and vomiting. And migraines are something that are a little bit of a different animal. There's the majority of folks think that migraines have to do with some spastic blood vessels or interruptions of blood flow to the brain. But there have been various other theories, including that musculature throughout the neck and head could be involved with migraines as well. So one of the treatments that I'm not going to further delve into with migraines, common treatments include medications that are specific for improving blood flow to the head and the brain. But also there are injections that could be done. Botox or botulinum toxin injections can be done in various muscles around the head and neck, and that can contribute to improving symptoms associated with migraines as well. Cluster headache is a different animal. Typically, people describe this as pain kind of behind one eye. And there are other types of headaches that are not listed on this, including headaches involving the various nerves of our face, and including headaches that are associated with things like traumatic brain injury or concussions, things along those lines. But putting all of these aside, there's actually a whole other category of headaches that could actually be associated with the musculoskeletal system. So very common headaches that are that are associated with the musculoskeletal system include things that are involving the various muscles around the head and neck regions. Various different muscles can cause pain into the head. And these are diagrams that depict the patterns of pain that we can see with tightness or spasming or aggravation to various muscles of the face, the neck, the head, etc. So on the top left, we have the masseter muscles, which are the muscles of mastication or chewing and biting that can cause referral of pain into various areas. Going across the top row are muscles. There are several different muscles in the back of the neck, which I'm going to get into in a little bit, but spasms of those muscles can refer pain into the head as well. And then there are muscles across the neck, your sternocleidomastoid, which is the big muscle that goes from the back of the ear all the way to the front of your collarbone. This muscle, or the SCM, can cause various different distributions of headaches as well. And then finally, we have even the muscles across the temporal region of your head that can cause distributions of headaches. And then the traps, the big trap muscles. And I'm going to get to those in just a second. Now, there are yet more headaches that can occur. And there are things such as headaches involving the facet joints in the back of the neck, as well as headaches involving the nerves that are in the back of the neck that could contribute to pain, various different pain distributions. Oh, that's a really small picture. Let me see if I could find something bigger. Now, in the back of the head, one of the type of headaches that I want to kind of focus on are those that are typically found in the back of the head, and essentially headaches that start in the back of the head and then wrap around to the front. These type of headaches can come from a variety of different sources, and including things like what are called the greater and lesser occipital nerves. Here we go. All right. That's not that much bigger, but let's see. Get that a little bit bigger here, and we can look at this more in depth. So this is a picture of the back of the head. And just to point out a few different things, this is the skull right here. And this is the start of the neck as we travel down. This is the C1, or first cervical vertebral body, and here's the C2, second vertebral body. We have these two nerves that come out of the neck region and go up into the head. These nerves, the greater and lesser occipital nerves, are in charge of sensation throughout the back of the head, and irritation of these nerves can actually wrap around the head all the way across to the front. This is a very common area to get irritated. When these nerves get irritated, we can have pain in the back of the head, or we can have things shooting. And the best way to diagnose if this is the thing that's causing your pain is by actually doing an image-guided injection of numbing solution into the area of the nerve and seeing if the pain gets reduced. And if a substantial amount of the pain gets reduced, we can assume that that nerve is involved. And the traditional treatment for this type of scenario is something like a cortisone injection surrounding that nerve to calm down the inflammation and then decrease the pain associated with it. But when that doesn't work, we kind of have to take a step back and ask the question, why is that nerve getting irritated in the first place? Right? What is it that's causing that nerve to get irritated? And is there something that we can do about that? Right? Because if we just inject some cortisone, calm down the inflammation of the nerve, but we don't address the thing that's causing the pain in the first place, well, that nerve is just going to get irritated again. So what are the different things that can cause pain into that area? Well, actually, spasming or tightness of the various muscles that are there. So I'll get these guys out of the way for a second here and show you another diagram. Oh man, this is another small one. Let's see. That's not bad. So this is another view of the back of the spine here. And these are all Google images, so I can't take credit for any of these. Sorry, I'm not giving credit where credit's due. But this is the back of the head, the skull here. This is kind of the region that we were looking at. Here's the spine vertebral bodies here. And you can see this is one big muscle that comes and attaches here, and a bunch of smaller muscles that come and attach as well. And in between these muscles, under, over, in between these muscles, are nerves like the greater occipital nerve. So if these muscles are getting tight, freaking out for some reason, you can imagine that those nerves can then compress things like the greater occipital nerve, right? So not only perhaps calming down that nerve, but also addressing the muscles can be important for long-term relief. Now, muscles are not something that we typically inject cortisone into, because cortisone can actually cause damage to soft tissue structures. So there are other things that we can address in these areas, use to inject into these areas. But why are the muscles freaking out, right? What's causing these muscles to get angry too? So, all right, if the muscles are tightening and irritating the nerves, well, what's irritating the muscles? Now, these muscles very commonly get irritated for a few different reasons. Probably one of the most common things that causes irritation to these muscles is if we're awkwardly moving or if we're putting our body into an abnormal position repetitively over time. And what is it that does that? Well, most commonly are things like when we're working on computers for long hours, particularly laptops, when we're looking at our cell phone for long hours, things that are putting our neck at a mechanical disadvantage, stretching these various muscles can cause irritation. Now, not always. People can live with poor posture, looking down at their cell phones in front of their laptops and have zero issues associated with their neck and zero headaches and all of that kind of stuff. But if this is something that we recently started doing, or if this is something that we're doing more of, right? With the pandemic, we started doing, working from home, remote working, and we have a poor setup ergonomically at our house, and we start doing this for long hours. Well, that's certainly something that could be an overuse injury that causes these muscles to tighten up and spasm. The other reason these muscles can tighten up and spasm is if we have hypermobility or looseness to the ligaments that are in the neck. The ligaments are the duct tape that connects bone to bone, and those ligaments can get stretched for various reasons. One of the reasons these ligaments get stressed is if you have a condition called hypermobility. And there are various different hypermobility syndromes, including EDS or Ehlers-Danlos syndrome. But we can get hypermobility both genetically or over time with certain activities. So there is a such thing as increased mobility of the ligaments due to over manipulation. So if you think about your chiropractic or osteopathic or physical therapy manipulation techniques that involve cracking of the neck. Although there's some folks that don't believe that repetitive cracking type maneuvers can cause looseness to the ligaments, the reality is that if we do this over and over and over again, we oftentimes can get looser. And I know this firsthand because when I was in medical school, I'm a DO, so I learned osteopathic manipulation, and at the school that I was at, we learned a lot of cracking maneuvers. Well, how would we learn how to do these maneuvers appropriately? Well, we'd practice on ourselves. But it got to the point that I found myself asking my friends and colleagues to crack my neck on a regular basis, and I was turning my neck around like I was an owl. And I was like, this isn't normal, right? So I had created some hypermobility in my neck by repetitively getting my neck cracked. And that can cause looseness to the ligaments. So what are the ligaments? I'm going to actually bring this model into view here. This is a pretty cool program called biodigital.com, and it shows a model of the neck. And this is kind of a 3D image of a neck, so pretty cool stuff. But this will help us visualize the different structures that are involved. So looking at the back of our neck here, we have your trapezius muscle that comes and goes all the way to the back of the head. So irritation or tenderness along that trapezius, as I saw in those pain diagrams, can cause pain into various areas of the head. Other muscles, your temporalis muscles, your masseter muscles, all of these things, your sternocleidomastoid muscles, all can cause various different headaches. But talking about this region here, we go and we could look deeper at all of these deeper muscles like the splenius capitis that can cause pain. And all of these are typically freaking out because of the looseness to the ligaments even deeper down. So as we go through this and go through all of these little muscles that are involved, we get down to the bones. Okay? And these bones are connected to one another. I might just need to, let's see if I can, there we go. No. Okay. So these bones are connected to each other with things like your facet joint capsules and your various different ligament structures. And if these ligaments get stretched because we're over manipulating or because we have genetic looseness to our ligaments or because we have an injury like a whiplash injury that suddenly stretches these various ligament structures, well, these are things that can then cause some looseness in the neck, which then contributes to the muscles wanting to tighten up to protect the neck, right? The muscles are like, crap, those ligaments have gotten loose. We need to tighten up in order to protect the neck. But when those muscles tighten up, they themselves can then cause headaches. Or they themselves can compress things like the greater occipital nerve. So you can see that there's actually multiple layers of things right off the bat that can cause pain into the head. And even things like the facet joints themselves, the joints between some of these bones, can cause headaches also. So how do I manage situations like this? So when I see patients that have headaches, I want to see what are the patterns that the headaches are coming in. And I do a thorough physical examination to see, all right, are there specific muscles that I can press on that reproduce the headaches? If there are some specific muscles that are involved, and if there is a mechanism of injury, like there was a specific injury that occurred that aggravated that muscle, it might be as simple as using something like a patient's own blood growth factors to inject into the muscles and get that muscle firing the way that it should be. But oftentimes I'm looking at the different layers of what are involved. Are there joints that may be aggravated? Are there ligaments that may be loosened? Are there muscles that then are tightening up? And are there nerves that are also irritated or involved? And when there are multiple layers, I like to hit all of the different structures. Now, it's impossible to hit all those structures and sometimes dangerous to hit some of those structures with things like cortisone. So instead, I use regenerative medicine treatments like a patient's own blood PRP, or platelet-rich plasma. Platelet-rich plasma, and you can watch some of my other videos if you want to learn more about PRP. But PRP could be really helpful because it could help with strengthening ligaments. It can help with improving the strength of facet joints and the inflammation involved with joints. It can help with getting nerves to turn on and fire properly. And some variations of PRP can be used to help with relaxing muscles and getting them to fire properly. If the situation's not severe or not chronic, if it's something that's more benign or acute, meaning that it's happened more recently and it's not a severe concern, then even sugar water injections, what's called prolotherapy, can be beneficial for these type of things. Prolotherapy could be really beneficial for ligament injuries, and particularly ligament injuries that are not as severe. And we can use various things like trigger point injections to help. Even just the passing of a needle through a muscle can help with relaxing those muscles and getting them fire properly. Now, all in all, there are various different treatments that could be used for these conditions, but it's very, very important to take a step back and look at what are the different layers of the onion, right? What are all the different things that are potentially involved? And only then can we look at getting long-term benefit, because by identifying those things, we can then identify the right treatment for each of those individual pieces of the puzzle. And that's that. That's all I've got. I think we can delve into different components of headaches. At one point, I'm going to be delving into the craniocervical region and craniocervical instability specifically. That's something that is an often underdiagnosed or misdiagnosed thing that could also cause headaches as a piece of the puzzle. So I'm going to talk a little bit more about that in future episodes. I have already done episodes on whiplash, so if you're interested in watching that, you can check us out on our Facebook page, on our YouTube page, or on our website, fxregencenter.com. If you have any questions or concerns or general questions or specific questions, you can comment, DM, or email us at info@fxregencenter.com. If you're interested in seeing me for consultation, then you can email us or call us at 310-929-9790. If you found this helpful at all, please share, like, follow, all that fun stuff. I hope you guys had a great Friday, and wishing you the best on your weekend. And we will see you next week.